Have you been in a situation where your doctor tells you or your pharmacist tells you to take a tablet, wait for like 30 minutes or 1 hour before you take the next dose, and you think they don't know what they are doing? They're only trying to avoid anything that has to do with interaction. And that brings us to today's topic on drug interaction. So hello guys, welcome back to my channel. It's your pharmacist Evelyn Awele, and you're welcome back to this channel. If you are seeing this video for the first time, you're welcome to this channel. But if you're an old subscriber, thank you for coming back, and please don't forget to like, to share, drop your comment at the end of this video, and turn on your notification bell so that whenever a video comes up or pops up, you'll be aware. So thank you guys for joining. Now, today's topic, we want to talk about drug interaction. Drug interaction simply means that there's a reaction between one drug or more than a drug. And don't forget, we're not only talking about drugs. It could also be between a drug and a food, or your vitamins, your supplements. It could be an interaction between your drug and your herbal supplements. And also, it could be an interaction between drug and any medical condition you're having. So when there's a drug interaction, it makes both drugs, or it makes one of the drug less potent or more potent, leading to more side effects. And when there's an interaction, one, it affects the mechanism of action, right? After affecting the mechanism of action, it reduces the therapeutic dose, and there's a therapeutic failure at the end of the day. Interaction can be divided into two. We have the pharmacodynamics interaction and the pharmacokinetics interaction. Let me not bore you with all these big jargons. Now, the pharmacodynamics now here, it actually means when there's an interaction between two drugs, and it reduces the sensitivity and the responsiveness to tissue by the other drugs. And when this happens, guys, it really reduces the effect of these drugs. Now, for the pharmacokinetics kind of interaction here, the other drug affects the absorption, the distribution, the metabolism, the excretion of the drugs. So you can imagine when these drugs are being affected one way or the other, is that the potency is being reduced one way or the other. Guess what? These drugs won't get to the site of action. Yeah, drugs have their bus stops. So it won't get to the site of action, and you're not going to get the right dose for your drug. You're not going to get better, and also more drugs might be in your system because the other drug can increase the level of the second drug in your system and becomes toxic to you. So now let's talk about drug-to-drug interaction. Remember, I told you earlier on that there is drug-to-drug interaction, drug-to-food interaction, drug-to-supplement, vitamins, herbals, or medical condition. So let us go back to drug-to-drug interaction. And here we are talking about interaction between two or more prescription drugs. Now, what are prescription drugs? These are drugs that are written by your prescriber, to purchase in the pharmacy. And you don't go and get this drug without the authority of a prescriber, telling you to go and get this drug. So these are prescription drugs. So there are interactions between these drugs. Take, for instance, a blood thinner, warfarin example. When you take it together with fluconazole, which is an antifungal, it makes the bleeding increases. Another class of drug-to-drug interaction is a drug and a non-prescription drug, like a prescription drug and a non-prescription drug. Now, a non-prescription drug is a drug that you can just go to the pharmacy and get over the counter. You need him to write anything for you. You can go to the pharmacy and go and get them. They are called over the counter medications. We have, for instance, your Advil, which is your ibuprofen. We have acetaminophen, your paracetamol, so those are drugs you can get over the counter. Now, for example, there's a kind of reaction between, let me say, a diuretics and a non-prescription drug. Diuretics are medicines that actually helps to remove salt and water from the system. Now, if you are taking it with Advil, ibuprofen, it's going to counteract the effect of the diuretics, because Advil actually retains the water and salt in your system. So you don't take these two together. It will antagonize the effect of the prescription drug, which is diuretic. So that's an example of drug-to-drug reaction. Now we have drug to food kind of reaction, like your beverages you take. There's a reaction, there's an interaction that happens between a drug and a food. One culprit is grape juice. Yes, like taking grape juice with some kind of antihypertensive is not so good. Increase the level of those antihypertensives in your system, and drugs needs to be excreted out of the system, so it becomes more toxic to you. So there are some drugs you don't take with particular kind of food. Then the next is alcohol. Why would you want to get drugs and be taking alcohol? Don't you know that alcohol can actually affect or alter the effect of most drugs? Yeah, so alcohol to also delay drugs because it causes sometimes dizziness and all of that. It can delay the action of some particular drugs. There's a kind of reaction called disulfiram-like reaction. Now, this kind of reaction occurs when a drug is taken with alcohol, and the kind of reaction one gets, it's not pleasing at all. Nausea, vomiting, flushing, abdominal pain. You just have a lot of discomfort here and there because you're taking alcohol and these particular drugs. Example of such reaction, a type of drugs that have such reaction is your metronidazole and your alcohol. Metronidazole, that's flagyl, and your alcohol. You don't take flagyl and alcohol at the same time. Sometimes I tell my patients, see, even after 5 days, don't take alcohol. It's like you're killing them. So that reaction is very, very bad. So those two don't match. They don't match at all. So you don't take them together. Then another kind of interaction is drug to certain medical condition. Okay, there's a kind of reaction to that also occur in some medical conditions and some drugs. For instance, a decongestant, which I usually use during when someone has cold, right? You don't give it to people that have high blood pressure. It can increase their blood pressure. Then also with metformin and kidney disease, people that have kidney disease, they don't take metformin at the same time. That's because it increases the amount of metformin in the system, or thereby increasing so much side effects. So with all of these, you need to speak with your doctor. You need to speak especially with your pharmacist. Speak with your pharmacist about the particular drugs that you are taking. Now note that not because this person have this kind of reaction, you will have this same reaction. So different people have different kind of reaction to certain medication. Personal traits can also play a role in anybody having a particular drug interaction. Number one on my list is genetics. Now, different people with their different genetic code makes people susceptible to having this kind of reaction, right? Then the next is weight. Do you know that there are some drugs that needs to be taken based on your weight? So when there's a change or there's an alteration in your weight, of course the dosage can change, and there could be a kind of reaction if your weight is not being calculated right for your dose. The next is sex. Now, because of different anatomy of the body and hormones of the body, that where we have the male and the female, there are some particular drug a male will take that they will react to it, but if a female should take these drugs, no reaction. So sex is also a determinant if there's going to be a reaction or no reaction. Then next is age. Yes, we all know that as we grow old, our system cannot be the same thing, our body cannot be the same thing. So for instance, your liver, your kidney, your circulatory system, they will change. So the way they will process some drugs, the way they will process some medication is going to be different. It's going to be slow, right, in breaking down and elimination of this medication. The next is your lifestyle. Yeah, your lifestyle, which is kind like your diet. Your lifestyle, your diet, kind of food you eat, as I said, can also determine if there's going to be an interaction, right, between what you're taking and your drugs. Exercise can also be a cause of a drug interaction. For instance, those people with that are taking insulin for treatment of diabetes, they don't do that during exercise, right? Immediately you just take your shots, you now start exercising. It can lead to hypoglycemia, that's reduction of your blood sugar. right? So what you can do, I'm not saying you should not exercise. Exercise is very, very good. So what I'm just suggesting is that what you can do is to, when you eat and you take your insulin shot, you just wait a little bit, right, before you go and exercise, so that it will not lead to drop in your sugar level. So I know you're really enjoying this topic. It's a very interesting topic. So guys, don't forget to like, to share, to drop your comment. Let me know if you've had any kind of reaction when you've taken a particular drug, and don't forget to subscribe. Thank you very much. So lastly, I would like to advise that you please, whenever you see a doctor or a pharmacist, always tell them that, see, I've taken this medication, or I am on this medication, I am on this supplement. Tell them whatever you are taking, whatever, yes, herb supplements you're taking, tell them to. But what I'm trying to say is ask questions, right? You have the right to know the particular drug you're taking. Yes, you have the right to know the drug you're taking. You tell them, even if it's just one medication, you tell them, this is what I'm taking. And also ask questions. This drug you're giving me, doctor or pharmacist, this drug you're giving to me, what are the reactions? What do I need to take with this drug? I need to take some supplements. I'm on so supplements. Do I need to take alcohol? I said alcohol is wrong. Do I need to take a particular juice? Do I need, or should I just use plain water to drink my drugs? I'm on this drug. What side effects should I be looking out for? Know the name of your drug. Some persons just don't know the name of their drugs. I just got it from the hospital. No. Please, we've gone past those times, right? You have every right to know your drug. You know the drug you're taking. You know the dosage. You know every possible side effect of these drugs, so that you will not be caught up in any kind of interaction that might be bad or worse. And you know the symptoms of any kind of interaction. Ask your pharmacist, what kind of interaction, what kind of symptoms will I see initially when I'm having this kind of reactions, right? So thank you guys for watching. I hope you've enjoyed this video and you've learned a lot from this video. If you have any question, you can send me an email, or you can just ask your question on the comment section and turn on your notification bell. You will regret it. So see you in my next video. Bye.